This is TVC News at 10, the edition that features Flashback, a recap of stories that made headlines during the week. But first, today's news. It's 100 days since the first recorded coronavirus case in Nigeria. In April, Nigeria ranked 5th in Africa among countries with the highest numbers of coronavirus cases. Now it ranks 3rd, coming after Egypt and South Africa. Nigeria, like many other African countries with a relatively weak health system, has been battling to curtail the spread of the virus the best way that it can. And now, with more than 200 deaths and over 11,000 cases later, the giant of Africa seems to be making some positive strides in curbing the spread of a virus that may never go away. TVC News' Kemi Balogun reports.
The virus was first imported into Nigeria through a 44-year-old Italian man on the 27th of February. He recovered and was discharged after 3 weeks of isolation and treatment, but not after donating his blood plasma to help the government in research. After its first case in February, Nigeria closed its borders after more than 30 cases, all imported, had been recorded. 100 days later, Nigeria now has about 10,000 cases, with new cases almost tripling on a daily basis. Since then, the country has sadly recorded more than 200 deaths and more than 2,000 patients have been discharged from isolation and treatment facilities across states. But this ravaging virus has brought world powers like the UK and the US to their knees, with increasing daily cases of up to hundreds of thousands. The US recently exceeded more than 100,000 deaths from the pandemic, and Nigerian health authorities still remain positive
We have early evidence of community transmission already, which reinforces the urgency of physical distancing, use of face masks, particularly where you cannot avoid a crowd.
Our target, following Mr. President's speech, is to get to 2,000 samples a day in Lagos, 1,000 in Abuja, and 1,000 for the rest of the country.
Since the outbreak of the coronavirus in Nigeria, many Nigerians have expressed optimism at the government's ability to tackle the spread. Many others have been so sure and had expected a lot more from the government, while other Nigerians still remain skeptical about the existence of the virus despite the growing numbers.
From the information we are hearing, I should believe, because sometimes if you doubt too much, the time you enter into trouble, you will not know. So for me, with the information on air, I should believe that there is coronavirus. Like me, if I go home now from outside, my children to do, I will say, don't touch me until I wash my hands and sanitize my hands before I will allow a contact between me and them.
With what the government are saying and with what the press are saying, I still believe there is a coronavirus.
The government swung into action and set up committees to tackle the spread across the Ministries of Health, Nigeria Center for Disease Control, and other ministries and agencies. To this end, the Presidential Task Force was inaugurated to spearhead all the modalities to fight the pandemic more effectively.
Truly, I will continue to emphasize that the only way we can be able to tackle this dreaded monster is when the citizens and government and its institutions come together to work on the basis of understanding, on the basis of support and cooperation.
Here we are talking about provision of guidelines, for instance. We have guidelines on patient care. We have guidelines on case management. We have guidelines on burial of persons who have died from COVID infection.
Then the lockdown for states began, starting with Lagos, Ogun, the Federal Capital Territory, and then eventually Kano State.
The advice of the Federal Ministry of Health and the NCDC, I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days.
With the ease of the lockdown came with it guidelines on wearing face masks at all times while in public, keeping physical distance, and also washing hands regularly in order to stem the tide of transmission.
the list is endless. And we say thank you to all of these partners. As we continue to learn the lessons from COVID-19 by fortifying our health systems and infrastructure against present and future pandemics, I wish to remind Nigerians that there is still a lot to be done and investment to make.
Yet, these precautions have not addressed the rising number of positive cases, with the possibility of a near economic meltdown became a grim reality. But the Presidential Task Force had worked tirelessly to ensure that Nigerians didn't feel the impact of the lockdown or the economic hardship that followed. But there are now increasing fears about how to curb the spread of the virus, considering Nigeria's weak healthcare system.
What is life after post-COVID? Because we also know that, the strain, it is hard on the healthcare system. We have to start ensuring that we have a strong prepayment mechanism in terms of health insurance. Most states have launched. Almost every state have set up their health insurance.
Nigeria presently has a daily testing capacity of about 1,500, from which close to 50,000 samples have been tested. It also has 29 functioning laboratories across states and about 112 isolation centers. Lagos still remains the epicenter of the outbreak of the coronavirus in Nigeria, and as health authorities continue to do all they can to limit the spread of the virus, a lot still remains unknown about the novel coronavirus, even across the globe. But the World Health Organization has also warned that this virus could remain with us for a long time to come. Kemi Balogun, TVC News, Abuja.